So if we have an abnormal papsmear and it follows the guideline where you need a colposcopy, meaning that it's HPV positive, it could be ascus, it could be low grade changes in the squamous cells, depending on whatever, any one of those that I just mentioned, you may have to do a colposcopy. A colposcopy is just basically doing the same process like a pap smear. It starts that way, but I have a scope that I look in and I look at your cervix and I try to see if I can see any area that I need to take a biopsy to send to the lab to see if it is indeed, precancerous cells. And it's just a tiny pinch. Just take some Motrin before you go. That probably help, to decrease the pain. But it's usually maybe 2 or 3 little pinches that they take off, very, very small. And we put it in different containers where we label what part of the cervix we take it from. And then we send it to the lab. The lab go ahead and they look at it and they send us back a results. And they say, well, either they say, yes, this is precancerous cell, or no. If it is precancerous cells, depending on the stage, we may send for another procedure called a LEAP, which is, where they take care of that area of the cervix, so to prevent it from going any further. So, but the colposcopy is kind of like the second stage after the pap smear. You do the colposcopy, and majority of the time the colposcopy come back negative. So don't be afraid to get it done. It's better to know than not to know. If they tell you need to get it, go ahead and go and get it, because that could save your life and save, complication further down.
For the colposcopy, you're looking through this scope. Is it magnified, or you're seeing
it magnifies the cervix,
what you would have seen with the pap smear?
No, because with the pap smear, I'm just taking samples. Right. But with the scope, I am looking, it magnifies the cervix and I can see the cells closer. So there are different cells that I'll be looking for to see if they are these normal cells. What are the different types of cells that are normal on the cervix? If I don't see the normal cells, or I see areas, white patches or something like that, I'll take a sample. I'm trying to not get too complicated and that people can understand. So I'll just take a sample of the areas that I see that doesn't necessarily look like a healthy cervix and send it off to the lab.
Is there any liquid or any painting or any dyes that you
put on the cervix? Yes, you do. Most of us use vinegar, because when you put the vinegar on the cervix, if there's abnormal cells there, it shows up.
Okay.
Makes it clearer, yeah.
And then you take the sample from that area that looks abnormal.
Abnormal, yeah.
So if you go in and everything looks normal, do you still take that little biopsy, or you just let it stay?
Sometimes depending on what the pap smear says, sometimes you don't take. Sometimes, and if the patient is pregnant, that's also a consideration as well, because you don't want to disrupt the cervix if the patient is pregnant. You want to wait until after you get it done. So if it's not something like, if it says high-grade lesions, yes, you do want to do that. I had a patient a couple of weeks ago that it said she had high-grade lesions. I went in and I did the colposcopy. When I looked at the cervix, I knew immediately that something did not look right. It was outside anything.
Cervix off, that is?
Yes, it does. During the procedure, they do remove the part that is cancerous.
Right.
I don't do that because as a nurse practitioner, that is not in my scope, but I send it to the GYN, the surgeon, and they go from there.
Okay. So the colposcopy, is this an expensive test? Is this something that, say for instance, I have an abnormal pap smear, but a colposcopy wasn't recommended. What if I want it? Can I just say I still want it and I go pay for that?
You have to pay for it. The insurance company is not going to pay for it. So different offices charge different prices, but it's a couple of $100s to get it done. I would say at least $300-400. That's on the lower end. It depends on the office.
Okay.
But it is a costly exam.
Okay, so this brings me to your role that you play in detecting, screening for cervical cancer, getting the colposcopy done. You have a office that you're starting up in Jamaica, and you're going